Welcome to the Speaking of Women's Health podcast, and Happy New Year! I am your host, Dr. Holly Thacker, the Executive Director of National Speaking of Women's Health, and I am back in the Sunflower House to kick off Season 2. So thanks so much for joining us, and what a Season 1 we had. And as we're celebrating the end of 2023 and we're charging ahead into 2024, I really want to thank you, the listeners, for supporting our inaugural year of the Speaking of Women's Health podcast. And we're so thrilled to be able to offer you a Season 2 in 2024. And you know, we couldn't have done it without all of you, our loyal listeners, and our supporters, and our donors, and the Center for Specialized Women's Health team. A special shout out and thanks to our executive producer, Lee Klecker, who's also a guest podcaster, and to my friend Sylvia Morrison, who helped market Speaking of Women's Health years ago when it was gifted to me, who's also a guest podcaster. And a special thanks to my family, my son Emerson, who prompted me to podcast years ago, and my husband Tom, my other sons Stetson and Grayson, my wonderful daughter-in-laws, and my 3 beautiful grandchildren who, as you know, I love to speak about. And so this time of year allows us to kind of reminisce, to kind of reflect on last year and start fresh. New year, new goals. And what would a new year be without some well-intentioned resolutions and a look back on some of the big advances we've had in women's health? So we at Speaking of Women's Health, we pledge to help you keep your resolutions by helping you be strong, be healthy, and be in charge, because that is our motto. The first thing I wanted to do in this podcast of Season 2 is go over some of the news highlights of last year, kind of in order of how we posted them. And if you don't already have speakingofwomenshealth.com bookmarked, please bookmark it. And if you're just listening to this podcast because you've got to it through social media, go to whatever your podcast app is, and for free, you can subscribe and follow our podcast so that you don't miss any podcast. And we have such great guests. A lot of times people like to see the guests that I'm interviewing. So if you like that visual interaction of a podcast, please follow us again for free on Rumble. It's Speaking of Women's Health on Rumble. Very easy to find. So some of the top news that kind of affected women's health last year, and that is going to be affecting us in this new year, is the FDA approved Zepbound, which is tirzepatide for chronic weight management at a 12 milligram dose. It's the same medicine that is in Mounjaro, and we had several podcasts in Season 1 about weight loss. We interviewed a weight loss, obesity, and women's health expert, Dr. Tara Iyer at Harvard. And for more information about that exciting class of medications, and I understand that there's a lot more on the horizon, and we're going to continue to bring more options to the market, because weight is the number one concern of women. And I think most of us are thinking about that at the beginning of a new year, how we're going to get to the gym, how we're going to follow a healthy diet. My son Stetson, who's going to be on an upcoming Season 2 podcast, the cancer geneticist, told me that he is pretty certain that in 30 years we will wipe out obesity based on these molecular advances. So stay tuned to that podcast. Other highlights in our news section, which is on our website. I was interviewed based on soy foods and how that may help with menopause and cardiovascular disease. We had the FDA grant authorization for DNA tests to assess predisposition to dozens of cancer types. 23andMe was granted new FDA clearance to report on additional BRCA variants. Now, if you do recreational genetic testing, it's not uncommon after everyone's gathered for the holidays. People talk about maybe they did Ancestry.com or 23andMe. It's important to know that all the cancer genes are not tested. Initially, just the 3 most common ones were, and now they've been cleared to test for more. Again, it's not medical testing. So for our listeners who have family histories of early cancers, it's very important to talk to your physician about whether you need a referral for official medical genetic assessment. The FDA also in 2023 approved the first non-prescription daily oral contraceptive. And we have lots of information about hormonal contraceptives on our website and free treatment guidebooks. There was an expert response to an article on hormone therapy and dementia. In general, hormone therapy is good for the brain, but once neurologic degeneration has set in and someone has been hormonally deficient for several years, then it is not beneficial. A big story after being off the market for 3 years, Pfizer did in fact bring back a tissue-selective estrogen complex, Duave, back in June of 2023 with improved packaging. And a lot of women with breast tenderness and sensitivities to hormones were very happy that that came back on the market. It was very exciting that we got the first non-hormonal candy neuron inhibitor, a non-hormonal drug to treat hot flashes and night sweats, fezolinetant. And I started off season 1 with free medical CME for doctors and advanced practice providers going over the mechanism of this class of medication. It's now on the market, Veoza, 45 milligrams a day, and it's been a big advance for women with severe hot flashes who can't or won't take hormones. Certainly, I was in the news interviewing regarding hormones and menopause and therapy for life, interviewed on television series, as well as research on early menopause increasing the risk of Alzheimer's disease if not treated. And 1 in 2 women, unfortunately, by age 85 will have memory loss. And what you do now is so important to protect your brain, to reduce that. And we do have some evidence that hormone therapy actually improves cognition and helps maintain brain volumes. And also, I was interviewed regarding research that looked at blood pressure effects with oral hormone versus transdermal and some of the benefits and risk to the different routes of administration. So now we're going to move on to talking about what are some healthy tips that you want to carry in to the brand new year. So number 1 is banish any unlucky numbers or negative thoughts. If you do suffer from seasonal affective disorder, so-called SADS, get treatment. Light therapy, exercise, and vitamin D can all help. The third podcast in season 1 was on vitamin D, and that's always important for a refresher, especially now in the dead of winter. Number 2, continue or walk steps per day and count it. We try to hit 10,000, but really even 6,000 or 7,000. Progressive increases in activity are helpful. Move more, sit less. There's so many different activity trackers, watches, phones, things that you can connect to your clothes. Most importantly, you want to start with a goal and keep track. Number 3, be sure to double check all medication directions for you and your family. Check expiration dates. Make sure you dispose of medications appropriately. And when you go in to see your healthcare team, bring in your prescription medicines, your supplements, not pictures, not, oh, just look on the chart, because there's lots of ways that there can be mistakes and errors.
We'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we're the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
Number 4, if this is the year that you're going to enter menopause, be confident that you've got a lot of options, hormonal and non-hormonal. And one of the most important things I can tell women as they're moving past the childbearing age and think you're done with all of that woman stuff, and periods and raising babies and thinking about contraception, it's so important to get anticipatory guidance and understand about perimenopause and menopause. Every day I see women in my office who just get gobsmacked and they're not even the least bit prepared and don't have any basic concepts or education. Number 5, try to get at least 8 hours of sleep. With age, people may need less sleep, and certainly younger people, growing children, teenagers need more sleep. Number 6, it's important, of course, to eat whole foods, fresh vegetables and fruits. Avoid processed foods and seed oils and sugars and all these convenience foods, which may taste good, but generally are not good for your health. Number 7, if you have a bad habit, and most of us at least have one bad habit, figure out what it is and deep six it. Number 8, beginning of the year, schedule all your health visits, your dental visit, your eye exam, your gynecologic exam, your primary care physician appointment. And just because you may not need a PAP and HPV test every year, and I hope to bring you some information about some of the advances in cervical cancer screening, some of the pitfalls that we faced now that women are not just ingrained to go in every year for a pap smear, you still need a yearly visit. You cannot skip your health maintenance visit. You are a lot more than a cervix. And for women who don't have a cervix and uterus, hooray, you don't have to bleed. But it seems like every week a woman told me, oh, I was told by my gynecologist or my nurse practitioner or some health person, I don't need to come in for exams because I don't have those organs. That is not true. Maybe it means that that particular clinician doesn't want to see you anymore since they can't operate on your pelvic organs. But that's ridiculous. You still are a woman and need exams, evaluations, and anticipatory guidance. And so you do need periodic exams. In general, Medicare does cover for a preventive exam every 2 years. We are having a brand new, well-trained nurse practitioner, Alex B., who just got married, who's joining our Center for Specialized Women's Health. So welcome, Alex. We'll have to have you on an upcoming 2024 podcast. Number 9, reinvigorate passions for some sort of physical activity or exercise, anything that involves moving more and sitting less, because it reduces anxiety. It helps your blood pressure. And really, exercise and good sleep and anxiety reduction are some of the best kept anti-aging secrets. And I'm in the anti-aging field. I always thought of myself as a well-trained internal medicine, hormonal, osteoporosis, interdisciplinary, gender-specific expert. And my son looked at me and said, Mom, you're just an anti-aging doctor. And that's true. I am, certainly without all the extra snake oil. And that's something to really be aware of. Health, promotions that want to take your money and promise you things without necessarily any kind of evidence-based aspects. And we're going to talk about future podcast, how to beware of some of this that's out in the community. Number 10, during family gatherings, which I know hopefully many of you have recently had, and hopefully you'll have plenty more in the new year, it is important to go over the medical history. It is important to know what your blood relatives' medical problems are. Another health tip: eat at least 2 servings a week of omega-3 rich foods weekly. And my last tip is gratitude. Find at least one thing every day to be grateful for. I hope you caught our wonderful last recent podcast in season 1 on gratitude and giving back. The late, great Holly Clegg, who was a wonderful chef, she shared many of her healthy and delicious recipes that we still have as an enduring tribute to her on speakingofwomenshealth.com. And one of my favorite recipes that I always look to and make at the beginning of every new year is the one pot New Year's Day meal. And cabbage and black-eyed peas with meat and rice make it an ideal one-pot family meal for that lazy, no desire to cook day. And it's really, really yummy. So you should definitely be checking out our website to get information, not just about health tips and exercise and stress reduction and midlife women's health and hormonal assessments and breaking health news. Sometimes we'll post when there's been recalls of either medicines or foods or even pet food. You really do want to make sure that everything that you ingest, whether it's a vitamin supplement and certainly food, is healthy. So you have been listening to the Speaking of Women's Health podcast, and I'm your host, Dr. Holly Thacker, and this is the first episode of season 2, just getting ready to celebrate the entrance of the new year, 2024, and I wanted to share with you one of my favorite recipes on the website by Holly Clegg. And some people catch our recipes on Instagram or on Speaking of Women's Health on Instagram. We're also on Facebook and formerly Twitter, which is now called X. We're on LinkedIn, and we're also have a Telegram channel and a Rumble channel, and we have a Speaking of Women's Health YouTube channel where we post videos. So this recipe, the one pot New Year's Day meal, includes 6 cups of shredded cabbage. And cabbage is a superfood. It's very healthy, and it's rich in many phytochemicals. And it also has DIM, which really helps your body fight HPV, the human papillomavirus. So always look to incorporate cabbage or broccoli or sauerkraut in your diet. So this is 6 cups of shredded cabbage, a cup of rice. And if you cook rice and then refrigerate it overnight, you can actually reduce some of the carb content of rice. 1 pound of ground sirloin meat, which is very rich in iron. My very first podcast in season 1 was on iron. 10 ounces of diced tomatoes and green chili. A 14.5-ounce can of beef broth. And you can either get it in a can or you can get those little cubes and just add some water. And then 15 ounces of that famous Good Luck black-eyed peas, rinsed and drained. And then a little salt and pepper to taste. I've been using SPG, which is a combination of salt and pepper and garlic. One of the brands, Slapio Mama, I think has a little touch of red pepper flake, which I really like, gives a little kick. Preheat the oven to 350 degrees. And in a large oven-proof pot, which my husband got from Santa Claus for Christmas, so I'm using that this year, you want to layer the cabbage, the rice, the meat, the tomatoes, the green chili, and the bean broth. And you cook for about an hour and 15 minutes, stirring after about 10 minutes until the rice is tender and liquid absorbed. And then you stir in the black-eyed peas and season to taste. I know a lot of families, especially in the South, will have collard greens on New Year's. And whatever is any of your family traditions or things that you want to hear more about, let us know. We're planning to have an area on our sites that you can give us some information and feedback about what you want to see or hear. So I now want to move in to talking about at-home beauty tips for the new season, because we women obviously want to be healthy and feel good, but we also want to look good. So this information is some content from a previously published column on our website by a graduated fellow who's now a practicing women's health specialist at the Mayo Clinic in Jacksonville, Dr. Sabrina Sani Sika. And she had some great health tips that were really kind of basic and natural, and was very interested in this. And so she wrote this on the verge of a new year for us a few years ago. Another year, another set of resolutions. Each year, we take time to reflect on the changes that help us become our very best selves in the new year. We might spend time and or good money on items that promise youthful looking skin, less joint pain, and even whiter teeth. And oftentimes we're led to believe that looking and feeling your best comes at a high cost. But did you ever stop to think what products that might be right under your nose, or at least in your kitchen cupboard, that might help you? So Dr. Sani talks about 3 common household items and how they can help you look and feel the best in the new year. Number 1, turmeric. It's a common household spice that's long been studied for its medicinal and scientific benefits. The active ingredient in turmeric is curcumin, and it's a polyphenol, and it's been shown to have lots of health benefits. It's anti-inflammatory, it's antioxidant. When it's applied directly to the skin, it can help calm down certain skin conditions like acne and rosacea and eczema. If you suffer from rosacea, you should catch my podcast in season 1 on rosacea with great content from another graduated women's health fellow and expert, Dr. Tiffany Cochran. In certain cultures, turmeric is actually mixed with other spices, in addition to honey and flour, to create a mask that's applied to brides and grooms before their wedding day to make their skin glow. So you can try adding a half a teaspoon of turmeric to honey for a simple do-it-yourself mask. Even try squeezing just a little lemon in it for extra glow. If you have sensitive skin, you might want to try incorporating turmeric into your diet. Adding a half a teaspoon to a smoothie might be a great way to look good and feel good. Since turmeric is anti-inflammatory, it can help in such ailments as osteoarthritis. Studies have shown that turmeric is superior to placebo in improving joint pain secondary to arthritis when taken daily. My retired nurse, Lily, that you heard from in season 1 about her retirement, swears by turmeric. And hopefully we'll get her back in season 2 to let us know how her first year of retirement has been. Because every phase in a woman's life is very special. And as we move from one phase to another, it's important to celebrate the past and look forward to the future. Now you might ask, okay, what is the recommended dosage for turmeric? Some have suggested 1,800 milligrams per day. If you're taking the extract, don't exceed 90 drops per day. If you're on blood thinner or have a history of gastrointestinal bleeding or diarrhea, you really need to speak to your clinician before taking it. You also have to be sure about the supplement you're purchasing. There were some turmeric supplements from Bangladesh that I think were contaminated with arsenic. Turmeric's not very well absorbed. Some people get the nano form or add piperazine, or even just black pepper helps with absorption. Now, the second natural item after turmeric for beauty is coconut oil. And coconut oil is quite versatile. I love using it as a hydrator, antioxidant. I put it on my skin. I do a coconut wrap on my hair, which is so dry in this dry winter air. It contains several MCTs, which are medium chain triglycerides, and has several therapeutic benefits on the body inside and out. So, coconut oil is a good moisturizer in the winter months, as I mentioned. And it can also be used to moisturize your cuticles or even with shaving gels. And if you use coconut oil, you're less likely to get cuts and razor burns. So, one of Dr. Sani's favorite uses of coconut oil is as a makeup remover. It's a great chemical free way to get rid of stubborn, waterproof eye makeup. I need to remember to do that tonight after all the celebration. Because coconut oil contains fatty acids, which are essential for hair growth, it can help your hair looking silky and smooth. Rosemary oil is another thing that Nurse Alex, who was on last season's podcast talking about what to expect and common questions she fields in women starting hormone therapy and what symptoms they have. If you haven't listened to that podcast from last season, please go back and listen to it. But Alex has wonderfully long, beautiful hair, and she swears by coconut oil, and actually the rosemary oil, which smells very nice. I put it on my eyebrows, and I know when you buy it, it can come with things to even put on the eyelashes. If you do suffer from split ends, dry or damaged hair, try creating a hair mask with coconut oil. And though coconut oil is effective on its own, some people will add in an egg or avocado to help lock in the moisture and increase that shine in the hair. Coconut oil, as I mentioned, is very rich in medium chain triglycerides, which some studies show to increase calories burned in a 24-hour period by as much as 5%, helping to lead to weight loss and maintenance. I add a little bit of coconut shavings to some of my health smoothies when I'm busy, I'm maybe seeing patients all day long, and I just only have time to drink a smoothie jam-packed with some superfoods. You can use coconut oil topically along with coffee grounds to make a little body scrub to help minimize, not totally eliminate, the appearance of cellulite. The third natural product that Dr. Sani talks about is apple cider vinegar. ACV has been studied for quite a while in several venues as a weight loss supplement, as a means to improve cardiovascular function, and a way to treat dandruff. Drinking apple cider vinegar regularly has several benefits, although not widely supported by all the literature. Many people who are insulin resistant take it to help improve insulin levels and reduce overall blood sugars. It also can help support a healthy gut microbiome. And if you missed the podcast I had with Dr. Ula Abed, our women's health endocrinologist in the Center for Specialized Women's Health, on polycystic ovary condition, which is an insulin resistant state in the type 2 frame, go back and listen to that very fascinating podcast, because at least 10% of women suffer from PCOS, and it has effects not only on fertility, which can affect your family size, but also other health outcomes from diabetes and cardiovascular disease and uterine cancer. So apple cider vinegar contains alpha hydroxy acids that help remove dead cells and help reveal your bright, vibrant skin. You can combine ACV with warm water to make a toner to minimize the appearance of your pores. Adding a splash of lemon can minimize sunspots or areas of hyperpigmentation. You might want to actually soak your fingernails for a minute in ACV before your next manicure, because the vinegar can remove excess residue and moisture, so that if you can dehydrate the nails a little bit, you have a better chance of that base coat of the nail polish adhering, leading to a longer lasting manicure with fewer chipped nails. That's something I really like. So I am going to try that before my next upcoming manicure. I'll let you know how that goes. Regular use of ACV can also improve the absorption of certain nutrients. So try adding a tablespoon of it to warm water. It is important to dilute the vinegar because if you drink it straight, it can be kind of hard on the enamel of your teeth. I add apple cider vinegar to several of my salad dressings with heart healthy olive oil. And my son Grayson, my youngest son, oh my goodness, he loves that with a little bit of pepper and garlic. Whether you want clearer skin or long lasting manicures or shed a couple pounds, improve your insulin level, just take a moment to stop and look at your own kitchen cupboard, and you'd be surprised how many items you have that you can help step up your beauty routine in 2024. And certainly beauty is something that all we women want to look good and feel good. And if you missed the podcast in season 1 with Lori Skarsko, one of the skincare estheticians at the clinic, that's a great one to listen to. And they really have great medical grade skincare products that are available without prescription. And some of them are with supervision, with physician supervision. So I would go back and listen to that. And hopefully in season 2, we can have more topics on beauty and health. Now, I know some of the upcoming podcasts that I'll do, and some of our guest podcasters will do, and some people that we're going to bring in to interview, just to give you just a little teaser of season 2. And if you don't subscribe to our free podcast, please hit the follow button. It helps us move up in the ratings. And then you get notified when we post a new podcast. So we're going to go over thyroid conditions in depth. 1 out of 8 women have thyroid conditions that can run in the family. So I think that's a very important topic for women. We're going to interview one of our nurses who is the one who helps our patients get ready for prepping for osteoporosis therapies. We do injections and infusions for more severe cases. And she's a wealth of knowledge, and she's going to be so excited in 2024 to welcome a new baby boy into her family. And I was so honored that our team was rated as one of the best podcasts in osteoporosis. That's certainly been one of my loves because it's underdiagnosed, undertreated. It affects 1 in 2 women by age 55, and it just doesn't get the attention. So we give your bone health attention here in this podcast. You're going to hear me interview my oldest son, a cancer geneticist. I am going to talk with one of our graduates, Dr. Alexa Fiffick, who is in private concierge practice in Westlake, about the dangers of pellets and other unscrupulous therapies that are pushed on midlife women. She's been seeing several issues, and she's going to give us a lot of tips and helpful advice. February is heart health, and so I will be covering a lot of different topics on how to keep your cardiovascular system in tip-top shape, bladder problems. March is colon cancer screening awareness, and unfortunately, we're seeing just such an increase in younger people with colorectal cancer. We want to touch on sports health and so many other topics. So I hope that's enticed you to stick with us for season 2 of Speaking of Women's Health podcast. And so that is a wrap for our first episode of season 2. Happy New Year 2024. And I'm wishing you and your family a happy and a healthy new year. And may you reap the benefits of this episode and live our Speaking of Women's Health motto to be strong, be healthy, and be in charge. We have a lot of other exciting announcements to make in the new year. So don't miss an episode. Subscribe, follow. It's free. Follow us on Apple Podcasts, Spotify, TuneIn, or wherever you listen to podcasts. And I'll look forward to seeing you back again in the Sunflower House. Share this episode. Give us a 5-star rating. And you can also donate to our nonprofit, speakingofwomenshealth.com. Thanks again, and I'll see you again in the Sunflower House.